So the World Health Organization on Friday warned that the COVID-19 pandemic is not yet over and says there's still a possibility of new variants. WHO Director General Tedros Ghebreyesus told attendees at the Munich Security Conference in Germany that vaccinations and the fact that Omicron has turned out to be a far less severe variant are driving a dangerous narrative that the pandemic is over. Let's speak now with Professor Ramneek Ahluwalia, Higher Health Education CEO. Professor Ahluwalia, thank you very much for joining us this afternoon. This is a sentiment by the World Health Organization that you echo. Why?
Good afternoon, Judu, and good afternoon to everyone. I certainly believe that pandemic is not over, and for everyone, they believe that pandemic is over is a dangerous narrative, as it's actually said by the WHO. And there are certain reasons for it, certain factors for it. The first factor is this is a mutating virus. And we clearly see that this virus likes a human body, tries to find a human body where it's of its liking, tries to hide into the human body. And what it does in that human body is starts understanding our immune system. And what it starts developing, it's changing its shape and color to what we call it as escape mutations. And that is what the world has to be careful about. And most probably the most non-vaccinated bodies, or bodies that do not have a stronger immune system due to other chronic diseases, give the virus that kind of space to sit, hide, and start mutating. And I think because when we know that only 28% of our young people are vaccinated so far, and only 17% of the whole African community is vaccinated so far, it clearly shows that the virus still has human bodies where it can sit, reside, and mutate. And remember, these mutations are not going to only happen in South Africa. It's happening all over the world. And I think the world is being cautious about these escape mutations, these mutants that we are going to see. The second factor is vaccination. When we clearly know that in South Africa alone, just 28% of our young people are vaccinated, it's a problem. When I say Africa, it's only about 17% of the whole African community is vaccinated. It's a huge challenge because this is exactly giving what the virus enjoys, finding a non-vaccinated body or a body with low immune system, goes inside to hide and start mutating. So vaccination has to play a very central role. Until people are not vaccinated, this epidemic or pandemic remains a huge threat. And the third important factor is, if you remember, in March 2020 came the original coronavirus, the coronavirus that we detected in Wuhan in China in December 2019. And then this virus has mutated to certain offsprings. Let's call it offspring. So there was an alpha variant. There was a beta that caused us a major second wave. There was a delta variant detected in India, came to South Africa, caused us a third wave. Now the Omicron. These offsprings and many more offsprings remain in the environment as much as Omicron still remains the dominant. What is happening with these variants which are still in the environment, which are still around humans, is that they are still sitting and residing and mutating. So what the world has to worry about is the offsprings of these delta, the beta, the alpha. They were quite virulent variants. And I think that's why the WHO Director General, that's why myself and everyone is trying to alert to say, well, the pandemic is still not over. Though it's a preventable disease, we can prevent it. But this virus still has a little bit of a challenge of mutations which remains with us, and we need to watch it very clearly.
Prof, I wonder then what you say to the school of thought that says, well, yes, we hear the low levels of vaccination on the continent at not fault of our own. However, there's a school of thought that believes that the continent has not seen as many deaths, as many infections throughout all 55 states as we have seen in Europe, for instance. And so there must be something, we haven't put our finger on it yet, that is actually right with us.
So something called, there are two things which are very important in the sciences now really correlating COVID-19. One is genetics. The other one is, the other issue is the natural immunity. Now, we know that 70% of South Africans, and I'm sure in Africa is the same story, and we're quite sure because we've got studies to prove it, that they got what we call it as a natural immunity from getting COVID. Remember, COVID was a novel virus, which was the human body had never had an immune system ever designed or developed to fight even our first, second, or third line against a virus which is so new. But through the virus entering our human body, through us contracting the virus, the body started producing a natural immunity. The challenge with natural immunity is that natural immunity, like any other immunity, even vaccine immunity, does fall down with time. And secondly, the immune system is only recognizing that particular type of a variant where it's trying to build its immune system. And that is why vaccine equity is critical, and that's why Africa is clearly telling Europe that if you want to save your own lives, and if you want to save the world global lives, then you have to ensure Africans also get vaccinated, because the variants entering into human genetics of in African communities or in other parts of the world, it's still giving the body a chance for the virus to sit, hide, and mutate, and also cause further variants that can even predispose us to our genetics, which this virus can change its color into, because all this virus is doing is, if it is not killed, so virus moves from one body to the other, it does not know whether you have a natural immunity or a vaccine immunity. It will enter. What happens is when it enters, it tries to bind to a human body, a human cell, starts eating, and more it binds properly, more it starts multiplying very quickly. And even in seconds, it develops into a huge force of its, what we call it as a viral load. But on the other side, our human recognizes and develops a lot of antibodies, our first, second, third line of defense, and starts overcoming it and killing it. Because we're vaccinated, we have immune system, we can defeat it and do not allow this virus to hide and start mutating or developing something called escape mutations or mutations that, because the virus wants to survive, it will mutate. It will try to change its color and shape so that it remains hidden. Even if it enters the body, our immune system cannot recognize it, so that it can freely enjoy multiplication, enjoy binding to our human cell and eat and survive, because that's its way of survival. So what we need to still understand, the world needs to understand, is vaccinating African communities is equally important. And the same appeal is for our young people in South Africa who have access to all these vaccines to get vaccinated. Because this is the way, even if the virus enters, your immune system will not allow this virus to multiply quickly and overtake the virus far more quickly, even if though the virus will still have some escape mutations to have what we call it as breakthrough infections. So I think this is the world has to recognize and respect every human, leave any human behind, ensure every human has access to vaccine, and ensure that's the only way we can suppress this virus and come back to normal the way we want to be, like the way it used to be in the pre-COVID era.
Prof, there are still concerns, while this is very much important and still very much present with us, that there are other communicable and non-communicable diseases that are still out there and very much prevalent. Are we still, emphasizing messages around that, especially with the work that you do with institutions of higher education?
Absolutely, absolutely. I think the other diseases are enjoying a free flow under the COVID umbrella. And I think this is the absolute information to be warning everyone. The HIV still remains around, remains the most disastrous disease. When I say 8 million South Africans in a disease which affects mostly the young people between 15 and 24, that virus is still moving around. When we talk about TB, and South Africa remaining the third biggest country after India and China, whose populations are quite tremendously bigger, as a fatal disease for South Africa, that pandemic remains around us. Teenage pregnancies. South Africa grapples with young women becoming pregnant. Not only maternal deaths happen, but lack to education, lack to many other parameters. Mental health. Mental health has grown tremendously, direct correlation with COVID-19 pandemic. Just under the COVID pandemic, we are seeing about 60 to 65% of our youth around South Africa and the total South African population feeling moderate to severe psychosocial effects of depression or anxiety. And this is real pandemics around us. And they will continue to remain around us, even though COVID we will try to remove. So I think the messaging around moving out of COVID and now making COVID part of the total health and wellness is now essential, because COVID is bound to stay. It's formed a human-to-human nature. It is
it is currently in its epidemic stage and eventually become endemic. HIV remains a major pandemic and still remains a huge pandemic. So these viruses, these bacteria, these non-communicable diseases like the mental health, maternal health, we're talking about non-communicable obesity, heart attacks, these, and they are all directly interrelated to each other. So the message will be is about first priority of every young African, South African, or any South African, just to look after their health and well-being in total, and not just prioritizing COVID, because they all remain together. And I think it's about us to look after ourselves. So if mask, ventilation remains and vaccination remains critical in COVID-19, condomization, ensuring we are faithful to our partners, ensuring that we show loyalty, and all the preventable measures against HIV remain equally important. Understanding TB as an airborne communicable disease, understanding mental health is not a taboo. It is, many human genetics are predisposed to it. It is real, it's around. Seeking help is critical. So early detection of any disease, even in COVID, even in HIV, if you get to know your disease early, even like blood pressure, you know your disease early, you can prevent yourself from any fatalities. You can put yourself on ARV, your immune system is as normal as any other human being. If you are with hypertension or diabetes, you take treatment early, you do not go into kidney failures or heart failures, and you can live as long as possible. So testing yourself, screening yourself, knowing about your human body, preventing, it's very critical for any economy, for any longevity, and for any success of any country's success. So you're absolutely right. We need to be very mindful of many others, not just the COVID.
Professor Ramneek Ahluwalia, thank you very much for joining us this afternoon, CEO of Higher Health.